Good day and welcome back to our channel, A Whole Lot of BS. I am Dr. Suzanne Snaggs Wilson, and this is my lovely daughter.
Yes, hi, I'm Bri, and for those who have not been with us in previous episodes, which where have you been? We want you here. A whole lot of BS just stands for Bri and Suzy, where we talk about a lot of mother-daughter topics and life stuff. So today, I am so excited for this topic, aren't you, Mummy?
Yeah, I think it's a really good topic and it's helpful. It's something that most people don't think about, but it definitely is important and it helps in terms of health, right?
So, for those of you who don't already know, my profession on my day to day life is I work as a dental hygienist in a private clinic. So, we wanted to talk more about what the dental world looks like and as well what oral health is, what it does for our body, why it matters, and trying to debunk some myths that some people may have or misconceptions that I usually hear on a daily basis, just to make sure that everyone's a little bit more knowledgeable, just because it is something that's super important, even though it's as small as our teeth.
hmm hmm Totally agree. And, the fact that we're talking about this really, especially for children, I do see opportunities for learning and understanding more what I see the truths behind, dental and dental hygienists and keeping those protocols in place. So excited to hear. Where do you want to start?
Okay, so where I wanted to start is when I say dental hygienist, I find that a lot of people don't understand the difference of dental hygienists, dentists, and dental assistants. Those are usually the main three in a dental office. I'm trying to keep it nice and broad for the general public because, again, I'm not going to try and use some jargon that no one understands. When it comes to dental hygienists, so if we start with a dental assistant they do a whole lot in the office. So dental assistants, they're always the ones running around doing sterilization. They're helping the office run smoothly, doing our orders sometimes, and as well helping alongside the dentist chair side. So the lovely ladies that are helping you, sitting you down, mostly sometimes doing your x-rays as well, and making the fun conversations with the dentist when you can't talk, those are the dental assistants.
That's good to know. And usually there tend to be more ladies than men. I wonder why.
Yes.
Another topic, probably.
Yes. So the dental hygienist on the other side is usually the ones that are actually doing your cleaning. So when you're brought into the room and you're booked for your routine cleaning, the dental hygienist is the one that is going through the education with you. We have a little bit more training on that side when it comes to the techniques of cleaning. We follow a scope of practice and usually are governed by a college-based system. So we have a governing body which allows us to do things legally and what they aren't allowed to do legally as well. So usually we're the only ones in the op with you at the time when you're doing your cleanings. And we will also do your x-rays under the discretion of a dentist. But most times it's usually at least in Canada, I'm speaking from Ontario sense, is just the hygienist doing the cleanings. There is also a step farther than that, which we call restorative hygienists, which they do fillings, but that's a whole other conversation.
Okay, that's interesting. Okay. And so
Yeah.
and so hygienists get to do x-rays as well, but then the dentist reads the x-ray. Is that correct?
Yes. So just like how if you go to, for example, a doctor's office, right? And the nurse, she does all of your blood reading, she does your blood tests, whatever it may be, asks you all the questions. She already has a general idea of what is probably going on, but
Mhm.
she's technically not allowed to diagnose it. That's
Okay.
what the doctor comes in for, right? So the dentist being the doctor in the dental office, they will come in and they'll give you their diagnosis. Usually the most common would be a cavity or whatever it may be to restore these teeth into health. That's some things that some people may not know, just the different roles that play in the dental office. There is a little bit more, but those are the three main ones on the clinical side. So that's client-based system.
Excellent. Can I ask some questions?
Yeah, absolutely.
Many times people are afraid to go to the dentist, and because of
Yeah.
that, they take a long time and so forth. But usually, when you go to the dentist, they'll say reschedule within the next 6 months or so. In terms of timelines, how often should people really go to and get cleanings?
Okay, so for people that are usually scared of the dentist, my number one thing is that you're scared of the dentist, but with most things, you always have to kind of get over it and desensitize yourself to it. When I say get over it, I mean you have to keep doing it to learn about it, right? Because it's scary at first, which with anything, if it's driving a car or if it's trying a certain food for the first time, some people see food, they can't try it. They're scared to try it, right? But for a lot of people, once they're desensitized to it and when they have done it routinely, it becomes less and less scary. I have a fear of planes. I still have to get on planes, unfortunately. But that's one thing with the dental office, which is, I guess, a common thing that we see is that a lot of people are expanding out the length of time. So their interval of coming in, and it's actually causing more harm than good at the end of the day. What I try to say to people is that if you're scared of the dentist, most times if you're mentioning that when you're going into the dentist, they are really accommodating. Like they want you to be there as much as you don't want to be there. But with the intervals, most times for intervals, it's actually client based. So a lot of people think it's, say, 6 months, the common thing people think, but 6 months is actually for more mouth that's in health. So when I say a mouth that's in health, we're talking bleeding gums. That's not a mouth that's in health. Breath that smells, that's also not a mouth that's in health. Teeth that hurt, that's not a mouth that's in health. And then things as coated tongues, any sores that you get in your mouth, things like that. Those are all signs of diseases and common oral health, unhealthy mouths. That's what we would kind of call it. To kind of go into it further, usually I would recommend for people that don't go to the dentist often, if you're getting a lot of buildup, usually we recommend 3 to 4 months for cleanings, which is probably a lot over the interval of time that people want to go to the dental office. But remind you, whatever the dental care professional is saying to you is not necessarily based on what you can afford or what you want to do. It's what they think is best for your general health. So I hope that kind of answers your question.
Yeah, it does. And it's interesting how there's a language around dentistry, like you're talking about interval, um, mouths that's unhealthy, those there's a terminology for everything.
There is a terminology. One thing that I kind of wanted to talk about when it comes to dental terminology is there's some common words that people hear but don't necessarily know the meaning of. For example, when you hear, just from a hygienist point of view, when we talk about gum health, right? Everyone knows the word gingivitis, or at least most people know the word gingivitis, right?
Mhm.
So gingivitis is inflammation of the gums. So when you see gums that bleed, so if you're brushing your teeth, sometimes in extreme cases, your gums may bleed even when you're just brushing your teeth lightly. That's not technically a mouth that's in health. Sometimes people find it with flossing, which is usually the most common time that people would find that their gums bleed, but we call that gingivitis. Again, there's a scale to everything. So you can have a very little amount, so we call it acute, or we can call it chronic, which means a larger, longer acting gum disease that's been there for a while. But gingivitis is reversible. So a lot of people get scared of the word gingivitis, but it's actually something that's reversible with just good at home care, routine cleanings, routine checkups. You can actually bring the mouth back into health.
Mm.
But what we want to avoid, and this is the part that I guess gets overlooked. I don't know if you've ever had these dreams, Mummy, but have you ever had dreams of like missing teeth or your teeth falling out, anything like that? Because that's my worst dream.
That's why you're a dental hygienist.
I know.
I tend to have dreams where I'm entering a room and I'm trying to turn the lights on and the lights are
Yeah.
not
Oh, that's yours.
my nightmare.
Interesting.
No,
I don't know how I can relate that back to dental, but
I'm sorry. Bit off topic.
no, but so when people talk about like teeth falling out or having loose teeth but that is a general thing that people do go through. And a large population of people that visit the dental office, they are in that stage, that point in time where their teeth are becoming loose and even falling out. And that's because that point in time is a point that we would characterize as a disease called periodontitis. And periodontitis is the step further from gingivitis. So, like I said, gingivitis can be reversed, but periodontitis can't be. Because now, instead of inflammation in the gums, we're talking about infection and bacteria that's now affecting our bones, so our jaw, and our jaw is what holds our teeth into it, right?
Mhm.
So when our teeth are being held on tight, right, by our bone, that's when our teeth are nice and strong. If you bite into an apple, you're fine. But there's some people that actually have to be careful when they're biting into harder foods because their teeth are not connected by connective tissues. And we call it a clinical attachment loss. So the attachment of the bone or to the gums is now lost and it can't be regained back. So that's when the teeth become loose. And unfortunately, some people have their teeth fall out or have to be removed.
Mm.
So that's the scarier side of dentistry.
Wow. Yeah, I didn't realize that. Well, first of all, I didn't know gingivitis was reversible,
Mhm.
and I didn't know about periodontitis. Is that?
Periodontitis. So titus being inflammation.
Okay. Okay.
Yes, yeah. Periodontitis. And there's actually clinics based around that disease. So we call it going to a periodontist. So they're dentists that are specializing in the periodontitis disease.
Okay.
Yeah.
Yeah.
There's a doctor for everything.
There. That's cool. And would you say when you think of different stages of life, so we've got young people, we've got, well, children, then we've got adults, and then you've got elderly. Are there different ways of brushing teeth or looking after their dental health as you go through those different stages?
Yeah, so I guess the most common stage that I'll kind of talk about is usually from when you get your adult teeth to around probably the point in time where you're getting more recession. So that's when your gum starts receding down and you're starting to see more of that root of the tooth.
Mhm.
So when we talk about brushing our teeth, the main thing that we're looking to do is remove that soft buildup. So when I talk about soft buildup, I like to explain it to my patients as feeling like sweaters are on your teeth. So you know that fuzzy feeling?
Mm. No.
So
Ah.
no. Good, good. Yeah, exactly. Right. Right answer. But so that fuzzy feeling that you get on your teeth, I know that when people brush their teeth, you get that squeaky clean feeling. And then all of a sudden, maybe 5 minutes later, that kind of fuzzier feeling or that textured feeling on your teeth starts to accumulate again. That's soft buildup. So we call that plaque.
No.
Um, Plaque is what we're removing when we're brushing our teeth. A common misconception that a lot of people have is that if you're brushing harder, right, you're getting a better clean, but that's actually doing more damage.
Mhm.
Yeah. So when people think about getting a toothbrush, like I'm sure when you go to, well, I got you an electric toothbrush already, so I don't even have to worry about you. But when you go to like a store to get a toothbrush, right? Most times people are not going to grab the soft toothbrushes. They're going for the hard toothbrushes
Mhm.
because it feels like you're getting a better clean, but actually it does more harm than good. So what it's doing is actually hurting your gums and it's over time damaging your enamel. So that's that outer layer surface of your teeth. When we talk about the teeth and structure, we have our outside layer, which is our enamel. So I like to call it the icing on the cake,
Mhm.
right? And then underneath the icing of the cake, you have that cake batter, right? And that would be your dentin. So that's what is kind of that yellowy color of the teeth. So over time, when your enamel, so the icing of your cake starts to wear down, you're starting to see that undercolor a little bit more.
Mhm.
Yeah. So when people start saying, oh, my teeth are turning yellow, it's that your enamel is just wearing down and that yellow color of your teeth. So your dentin is showing a bit more. So that's the part we're trying to not get to, right? So we're trying to save our enamel, so our icing on the cake as long as we can. And with that, we have to focus on not brushing your teeth really hard. I like to recommend electric toothbrushes to people if it's right. Usually, most times, in a general sense, it is because it stops people from brushing really hard, and it also gets into all those areas that we're missing with human error. So when we think about mechanically going and scrubbing your mouth, right? And you're going left and right and down and up and all around on all your teeth surfaces. The electric toothbrush, since it's vibrating, it's getting into all those areas that we're missing and we don't know we're missing on a daily basis. So that's why I bought you guys all electric toothbrushes, which you guys are using, right?
Yes, I love using my electric toothbrush. It feels better actually
Yeah.
than I.
So after a while, you'll realize, like, for people that do have heavier buildup, the electric toothbrush does so much without them even having to try as hard.
Okay. Yeah.
So when we talk about life stages, I think that definitely your at-home care is something that is needing to be paid attention to, because something as simple as switching the type of toothbrush that you're using. So, switching from a harder toothbrush to an electric toothbrush or a soft toothbrush, because again, we're just trying to remove that soft buildup, right? Anything harder than that, you have to go to a dentist to remove anyways.
Mhm.
So, using our tools at home and switching our at home care can do wonders for us in the long term.
Mhm.
But when we talk about kids, they pretend to brush their teeth. I remember when I was a kid, I used to go and I would brush my teeth, quote unquote, brush my teeth for 5 seconds.
That's funny. And you'd come out like, "Look, mommy, I brushed my
I
teeth."
brush my teeth and you get that minty fresh breath smell, but like that's like chewing a piece of gum at that point. So, yeah, with kids, you have to really be careful and watch your kids. I think that a lot of the times we have parents coming in, and a lot of the times our like kids' mouths are very susceptible to that bacteria that causes cavities.
Mhm.
And it's all from them just not doing a really good job at brushing their teeth at home
Mhm.
when their parents aren't around. And that's taking that time, that 2 minutes, and that 2 minutes is to allow the toothpaste to kind of integrate the ingredients into our teeth. So usually the fluoride is what is doing that,
Mhm.
and to help strengthen up the teeth again. So kids, we're giving them out timers now. Like those little sand timers.
Mhm. Mhm.
Whenever I ask a child, I'm like, "Hey, how many times do you brush your teeth?" They're like, "Twice." And I'm like, "Okay, and how long?" And they're like, 100 minutes, because they don't know the sense of time, right? They don't know the sense of time. And I'm like, "Okay, I'm gonna give you a little sand timer. This is your new friend, right? And it's a race, okay? So you want to keep brushing your teeth, right? Until that sand timer is all the way finished at the end, and then that's when your race is done."
Oh, that's so sweet. You must make a really nice dental hygienist. I bet your patients like you.
I think so. I would hope so. I still have a job, so that must be a good sign.
That's cool. That's cool. It's interesting that we talk about teeth and so forth. It's something people take for granted until it's no longer there. So
Exactly.
it's important that we do understand cleaning. Now, when you think of brushing, I try to brush, at least 2 or 3 times a day. Is that too much? What do you think?
No, yeah, I think that there's an excessive amount, yes, but 2 to 3 times a day is usually what I would say would correlate with meals, basically. So, usually after your breakfast, some people like to brush before breakfast,
Mhm.
or after breakfast. It depends on, I like to say it just depends on what you want. There are benefits to both. But then at night is probably one of the more important ones, because you're removing everything that you have accumulated in your mouth throughout the day. And
Mhm.
then some people like to brush after lunch, which is also completely normal. So 3 times a day is normal. I would say two is sufficient. Once is definitely not enough.
Okay, yeah, I would totally agree. And then flossing. Apparently, that is like a major must do.
It is. It is. Flossing is one of those things where it's like going to the gym. We know it's good for us, but we hate doing it. Like, it's just getting into the habit. So when we talk about flossing, there's a bunch of different types of flossing that people do. So flossing is ultimately to get underneath the gums. So when you think about brushing your teeth, right, you're getting most majority of what's on the teeth that you can see, right? But
Mhm.
again, your teeth goes down into your gums, right? Your gums are covering the root portion of your teeth, which is still super important to clean, which is what the flossing does. So the flossing gets in between the gum and the tooth itself and
Mhm.
cleans out the soft buildup that would be sitting there, which you can't usually get with a toothbrush, especially if you have gums that kind of dip lower or deeper pockets within the gums. So that's where the attachment loss comes into play. Because when your gums are inflamed, your gums are a little bit more puffy, so it's leaving a lot more room for that bacteria and that buildup to kind of get in between the gum and the tooth. So that's what the flossing is for. And that's a huge, huge difference between health and not bleeding gums to bleeding gums and seeing people kind of fall into that hopefully not happening phase of periodontitis, right?
Yeah, yeah. That's
So,
cool.
sorry, what I was going to say is if you were going to ask how much is enough, I would definitely say again, morning and night would be more than enough. But once a day is usually what I find that a lot of people do.
Yeah, I see people doing that. Like, if there's something stuck in your tooth, you'll take your nail, or you would take.
Oh no.
I know, right? Like, I guess it's using tools that really should not be used on new teeth, but you tend to use whatever close at hand.
Right. So when we talk about floss, there is string floss, there's those floss picks. So that's the little C-shaped hook that has the string in between. They're probably the easiest and most common for people to use just for dexterity reasons. So sometimes people find it's harder to get your hands into your mouth and get all the way to those back teeth. But with those floss picks, they're easier. But you have to watch how you're doing it because some people are just putting the floss in and out, in and out, in and out. But you need to get underneath the gums and kind of caress the tooth with it. That's what's making the difference. But now we have water flossers too, which again are a huge thing right now where for areas that you are finding it harder to reach with the floss, that is a happy alternative. Again, it doesn't do everything that floss does, right? Like regular string floss, but it is something's better than nothing at the end of the day. And it can be used in tangent. So usually I kind of recommend using both. When we talk about, for example, washing your dishes, I like to say, would you take a rag and just wipe down your dish? Or would you wipe down your dish and use water together to get the best clean? You're probably going to use both, right?
Yeah, that's true. That's a good point. I do have a water pick. I love water.
Nice.
I love to use it more because it's,
Yeah.
everything is time, right? But I'm glad you mentioned about the water pick and being able to use both, not one or the other.
One thing that I wanted to kind of talk about a bit before ending the podcast, though, is some things that some people don't kind of consider when it comes to teeth. And when we talk about oral health, we talk about oral health as like a systemic. So we're talking about systemically what it's doing for our body, right? And again, we think it's just our mouth, it's just our teeth. I'm just going to brush once a day and call it a day. Maybe I'll forget about brushing today and whatever it may be, right? But we talk about gum diseases, but our mouth is a gateway to our body for other diseases. So when we talk about tooth decay being the main, I guess, disease or the main thing that happens in our mouth, I'd like to also bring up the fact that also diabetes and oral health is connected. So when we talk about high blood sugar, it can also affect your way of removing bacteria. So your body's way of removing bacteria in the mouth. And also systemically, most times what happens is if you are diabetic, right, your body is producing a fruity breath smell for people that are undiagnosed. So most times that's a key sign that, hey, you're diabetic or your body is diabetic because it's producing like a sweet smell, a fruity smell in your breath that a lot of people don't realize is a systemic sign. And as well, heart disease, like inflammation and bacteria that's in your gums can enter into the bloodstream and contribute to a lot of cardiovascular problems that a lot of people don't pay attention to. So again, these are things that no one thinks about, but that's what we try to educate people on in the dental office, right?
Wow, that's interesting to know. And I've actually read that recently too about that fruity smell. If can sense that someone is a diabetic if that's happening. So yes, like you said, the mouth is the gateway to the body, right? And it's not just about your teeth and a nice white smile, it looks at more like in terms of your health, and it can actually trigger issues. I've heard of people who had tooth decay and then had an abscess and then really ended up passing away because they didn't attend to it. So it's an important aspect for us to take a look at and understand the root cause of some of these issues.
The root cause.
Yeah,
Wink.
cause. That's cool. Well, I really appreciate you sharing today. I can tell that you are passionate about your job and what you do and why you do it. Many people enter into careers and we don't know why. Why is this something that they choose? And when you selected to get into dental hygienist or into that field, I wasn't sure. I was like, okay, right.
Where did this come from?
Right. But you've always, you're always sort of thinking ahead and knowing what you wanted to do in life and so forth. So I really appreciate that you're following your heart, but you're also helping other people along the way. And that's a key piece. So thank you so much for sharing your knowledge and wisdom. I really appreciate it.
Of course, yeah. And I remember I said it when I was a kid that my goal in life is to make people smile.
Yeah, I used to say that. It's true. And here you are.
And here I am, and I didn't know it had anything to do with dental. I thought it was just making people happy. But at the end of the day, it's the same thing.
Yeah, totally agree. Well, thanks for the conversation. Love you.
Love you. We'll talk later.
Okay. Bye bye.
Bye.